Welcome to the Passion for Patients podcast. I'm Tonya Winders, your host and the president and CEO of GAP, the Global Allergy Airways Patient Platform. Together with our 130 patient advocacy groups, we're working to ensure that the world lives better and breathes better. Today, I'm excited to welcome to the podcast Vildana Moykitsch, and Vildana is coming to us from Bosnia. She is one of our passionate patient advocates who has done amazing work working alongside healthcare providers, doctors, and policymakers in her country. And so welcome, Vildana. We're excited to have you on the podcast today.
Thank you, Tonya. Thank you very much. It is my pleasure to be with you today.
Great. So I always like to start the podcast by just asking a little bit about your background and what really prompted you to become a passionate patient advocate.
Okay, if you're a patient advocate, you are a patient or you are a caregiver. So I'm a caregiver, and that's my motivation. I'm the mom of a 15-year-old son who has allergies, asthma, and atopic dermatitis. And that was my motivation to found and to start and to be very active in advocacy, improving life of patients with atopic diseases.
Right. So, and I know you've got a background in sort of marketing and business as well. Has that helped you be a more effective advocate?
Yeah, for more than 10 years, I've been in social marketing. So I created different kind of communication strategies and campaign in social marketing, which gives us, let's say, added value in communication where you educate public and people about their needs. So definitely it helped a lot when we talk about advocacy. So we know that we need to create or we need to educate the public about the need or about the issue. And this is what we do in AAA Association Bosnia and Herzegovina. We advocate through creating communication strategies that directly communicate with healthcare providers and policymakers, because there is a situation where they didn't hear about allergy or they didn't hear about atopic dermatitis as being, it can be very, very difficult disease or, problem for the whole family. So it's not oncology part of the disease, and they just, they don't take it that seriously. So we educate them and we create strategies, and that's definitely something that helped me, my background helped me to work on.
That's really great. And I think it is about leveraging the skills and experiences that you've had in your life to be a more effective advocate. That's what I hear you saying. And specifically there in Bosnia, you had a moment in time a few years back where you decided, I'm going to really activate the healthcare professional community and the policymaker community with educating them on the patient lived experience. So how did you begin working with them? Tell us a little bit about that.
Exactly. Thank you for mentioning that, because it's something that we are really proud of. It's a project of the educational event. It's called AAA Congress, and the 6th one is going to happen next year. So we have that continuity in development and education of healthcare providers. So everything started with definition of an issue, the problem, and it was lacking of education. So we understood that we don't get the right treatment, or we're not taken seriously enough because our physicians were not in a position to maybe listen to the new studies or hear or read, or they don't get the information from the right sources, because Bosnia and Herzegovina is still in the process of development, let's say, when we talk about health. So when we met, and when we defined the issue, we said, okay, we're going to do it. So we'll bring you the knowledge. So we find the best physician in the Europe and in the world and asked them to help us. And they did. So it's a very positive.
You say that like it's nothing, Vildana, but I know that this is like, I want to pause you there, because you just sort of skim over it. Like, we identified the best in the world and we asked them to help us. Like, that took some real guts to do that, to reach out and to say, hey, I'm from a small Eastern European country, but we deserve the best science, the best health information, and I want you to come help me do this. So I don't want you to pass over that because I think it's a really important aspect of the work that you've done there.
Thank you. But we decided to be very positive, and we decided in this podcast to encourage all patient organizations to start working on their position. So we will not talk about that very hard moments that we all go through. Of course, there is a lot of work in between. There is a lot of disappointment. There is a lot of moments when you're not taken seriously. But that was our dedication from the same beginning, that we want to be taken seriously. We don't need your donation. We don't need your grant, in a sense, on the basis of incident. We want to change the position and the healthcare system. We need systematic solutions. And that's something that was very hard from the same beginning, because we thought, we weren't received as serious as we wanted at the same beginning. But right now, I guarantee you that we play a very important role in this healthcare system in Bosnia and Herzegovina, because they take us seriously and they take our advices. So it was hard work, but it's always important to define the biggest problem that you have in your community and in your country. So sometimes it's not, the education is not the issue, But we have, let's say, two basic problems. It's access to treatment and education. And of course, if you don't have healthcare providers on your side to put effort and forces to change situation and get treatment, then you cannot do it on your own. So this is the circle that all of us should be in, and we should be in very good relations, and we should understand that we are on the same page. Because, it's very common, not only in Bosnia and Herzegovina, but everywhere, to see pharma industry or physicians, that we are not on the same page, okay? You don't understand us. But we need to be together, because they are great physicians, they are great pharma industry who really support patients, and we want to work with them. So we said, no exclusivity. We don't want to communicate with someone who doesn't have patient-focused, let's say, strategy, but the one who has, those are our partners. So that's the way in how everything should function at the end, to make things systematically. And that's the point, because it's not only for us, it's also for the future diagnosed patients. So we are working now for them as well, the one that will be diagnosed in 10 years.
So 5 years of hosting the AAA event there in Bosnia, what are some of the keys that you found to really making them successful, and to making sure that it's not just about the one and done weekend event of educating those healthcare providers and patient advocates, but it's changing things, it's changing the landscape, changing the expectation of the level of care long-term for the people living with these conditions in your country?
Well, something that we recognize, let's say, one of the most important for us, most important things during this development and during this education process is that we bring, let's say, the physicians who are influencers. So when we get them, we make sure that they hear the best practice, up-to-date practices, and then they just put it down to the primary care physicians, and they become our ambassadors. So that's also one of the things that I've just mentioned before. They become our allies. They started to support us. So when we write to ministries, we call them and say, can you also write to ministries? Because to Minister of Health, because, we need this medicine. So they become our friend. They know that what we do is not something that is only one term project. It's something that is going to last. And also the biggest success is here that we are building relationships. We also, through this Congress, will build relationship with the medical students. So we in October, I'm going to talk on the Faculty of Medicine here in Sarajevo. We will have the panel discussion where we encourage so we want to raise new physicians, okay? We want to raise physicians who will see with different eyes, who will take
it's impacting that future generation of caregivers, of healthcare providers to do that differently.
Exactly. So it was from the same beginning, it was it was long-lasting project. It was long-lasting strategy. It wasn't something that we just work on for a month. And of course, we have that kind of project. But if we talk about real change, we really need to, have 10-year strategy, how everything and everyone can be involved in the same goal. So I see AAA Congress as a very potential, let's say, source or stage or media for the change in Bosnia and Herzegovina. So just one example from the last Congress, we had Minister of Health, who is right now, so we are finalizing the access to treatment to JAK inhibitors, biologics for asthma, and something that is the product of this project. So at the end, we always evaluate. So every Congress, so we say, okay, this Congress, we will advocate for this medicine. And then we follow it for the whole year. And next year, we will announce what have happened. So
it's with my continuity of having a key goal and aim, and then following that, reporting the progress, and reevaluating on an annual basis, keeping people informed. Like, that's what makes these events so successful in my eyes, Vildana. It's not a one and done. There is that consistent theme throughout, and each one has built on the one before and the one that's coming after. So super, super helpful and powerful. So as we wrap up kind of talking about the events and partnering with HCPs, is there any final word? If someone's sitting out there, trying to consider should we be doing education of healthcare providers? Should we be engaging government in these kinds of event-based activities? What would be your final word for them?
Yes, this is, as you said, it is a complex project. There is the complexity, and there is something that needs to be, you always need to calculate with different kind of problems that are on the way. This way of your presentation is always important, but education is key for everything. So we do a lot of health literacy activities for the patients as well. So when you have education on your side with credible sources that we always communicate, you are perceived as a serious partner, and then, eventually they will all be on your side. It's not, one day event and you just need more time. But if you are dedicated to your long-term goal, then definitely these kind of projects is something that must be successful.
Well, thank you, Vildana. I really appreciate you sharing your expertise, your experience there in Bosnia, and the difference that you've made, not only for your patient community, but for your provider community. You saw the need where there were few allergy specialists, where really people were not getting the level of care that they deserved. And you decided to step into the gap and to make a difference for those patient lives and in those healthcare provider lives. And so thank you for doing that. And thank you for sharing that here with us today. As we close the episode, I want to encourage you to share this podcast with other patient advocates that you know, those within and outside of GAP. I want you to share, retweet, repost, take a look at some of the downloadable resources that we got in the show notes from today's podcast, and make plans to tune in for next time. And until then, stay passionate.